Hi everyone, am I audible? Is the audio visual clear? Is everything fine? Can we start? Just drop me. Yes, paper was tough. Okay, so I think students have joined the session. So, few comments on the paper. Paper pattern was unpredictable. The image based questions were unexpected as we got videos in FMG. So it's like they are upgrading their pattern. Like UPSC has shifted from theory based questions to image based, and the NEET PG FMG has upgraded themselves from image to video. Okay, so upgradations has happened. Paper was lengthy and paper was twisted, but the matter was same. So when we discuss this paper, you will automatically get yourself the that yes, topics were of previous year, some not complete, but how they twisted and how they made you confuse. And this examination was not just to test you, it is was to test your mental pressure, because this time there was not a proper segregation of PSM, surgery and obs gynae. They just jumbled it up. So it was a quite twisted and it was really an interesting paper. Okay, we'll discuss the cutoff once. If I have to suggest for the cutoff, if anyone getting 300 plus, then definitely he is up for the interview and he's definitely in for the selection. And if someone scoring between 250 to 300, then it is dicey. Not he's completely out, nor he's completely in. So it would be like that. Let the answer key decide and let the cutoff. See, result will be out within a month and the UPSC answer key will also be out within a week. So whatever controversy we will face in today's discussion, once the answer key is out within a week, so if anything's get changed in that, so we'll definitely update you all with that new answer, है ना? Because PSM says something else and obs gynae says something else, so there's always an controversy. So there would be 5-6 controversial questions. We'll not fight for that. We'll understand how can we mark the other answers. Okay, so we are starting without any further delay, and I want your participation in that. If any time you feel like that this answer needs to be changed, you know something better, then you are free to tell, right? So let's look at the first question first. So they were asking about the management for the chronic uterine inversion. Okay, so chronic uterine inversion may I have told you like for the inversion of uterus we were having three operations: Holtian, Kussner's and Spinelli's. If you have remember that, so with the help of that we could have ruled out yes we have Holtian, yes we have Spinelli, we don't have Gillian's. Instead of that we have Kussner's. So answer would become 1, 3 and 4. But if we follow Datta in detail, so what Datta says is, like if we perform the rectification abdominally, that is known as Holtian operation, and for that we would be cutting the posterior ring of cervix. And if we do the procedure vaginally, then that operation would be called Spinelli's operation, and in that we will cut the entire anterior ring of the cervix. So in short, both anterior and posterior ring can be cut in the cervix. So what were the options were? Yes, we have Holtian's method, yes, we have Spinelli's operation, and yes, we can cut both anterior or posterior cervical ring. So answer for the first question becomes 1, 3 and 4. If we talk about the second question, majority of students were confused in this, as they were saying कि ma'am when we calculated it our mark it was around 5. So how can you say that effectiveness is high? So if we talk about Datta, so Datta was saying, I have taught you in class also, there was contraceptive effectiveness where we have a pregnancy failure rate formula. So if we put values in that, so 10 was accidental pregnancy into 1200, and how many patients observe? We observe 100 patient and there was 2 years, so it will become 24 months. So that was coming out 5. Then how to choose high, moderate and low? So they have gave you an example कि when the pregnancy rate is less than 10, the effectiveness of the particular method is going to be high. but if it is more than 20, then it is going to be below, and our answer was coming 5, so it is less than 10. So effectiveness is going to be high in this case. And if we check about in Datta, it is giving the same. They have same pregnancy failure rate, and they have explained you with an example, and they are saying if it is below 10, we will consider it as high. So answer for the second question is going to be high. The effective matter is high. If we talk about the third question, so they were saying in the postpartum period, the intrauterine device may be inserted in the woman. So I have told you what is the time of insertion of IUCD. So within 48 hours after delivery, before the patient is discharged. So answer for this is going to be up to the 48 hours of delivery. Next question was very predictable. It's like important question for the contraceptive, that which of the following are absolute contraindication, that should not be wrong of anyone. So absolute contraindication mein I have told you multiple times, diabetes will come, liver adenoma will come, history of stroke will come. Age 36 year non-smoker is not a risk factor. So this was the list of the risk factors. I will not discuss it right now. So answer is 1, 3 and 4 for this. This was regarding progesterone only pills. So I have taught you progesterone only pills, that is known as mini pill. It contains very low dose of progestin, right? So here in one of the option they were saying it contains high dose, which itself becomes wrong. So first statement is wrong. Second, they were saying that it doesn't have on and off regimen. So yes, we have discussed that there is no on and off regime for this. Third, they were saying they can be used with hepatic enzyme inducing drug. We cannot use with hepatic enzyme inducing drug. They will, alter the effectiveness of the drug. So we will not use with this. And the failure rate was around 0.3 to 2%. So yes, failure rate was around to this. So answer is going to be 2 and 4 for this case. And this was the failure rate of progesterone only pills. Now this is a controversial question because PSM says something and the Datta says something, right? So they were asking how many ejaculations and months are required for a man to become sterile after undergoing vasectomy. So after undergoing vasectomy, if we follow the Obs-Gynae Datta, so they were saying that it requires 20 ejaculations for about 3 months. But if we follow 28th edition of Park, so they just mentioned 30 ejaculations. They have not talked about months. So if this question is framed by any Obs-Gynae faculty, then answer is going to be 20 ejaculations 3 months. But if it would have been framed by PSM, so it will create controversy among C and D. But most of the chances high are there that they will go with 20 ejaculations. Because if we go with the recent edition, I think I have not attached that. Okay, so it was 20 ejaculation and 3 months as per Datta. We'll go for this. Which of the following statement regarding lactational amenorrhea methods are correct? So if we read lactational amenorrhea for Datta, so they were saying that there should be exclusive 6 months breastfeeding and which offers the protection, and the criteria for successful lactational amenorrhea should be there should be continuous amenorrhea and breastfeeding for up to 6 months, and more effective in women who are amenorrhoic than those who are menstruating. And the risk of pregnancy who is exclusively breastfeeding for 6 months and amenorrhoic is less than 2% in the first 6 months. So let's look at the question. They were saying it is equally effective in amenorrhoic as well as menstruating women if the woman is exclusively breastfeeding. So this is incorrect. Risk of pregnancy in amenorrhoic woman who is exclusively breastfeeding is less than 2%. Yes, this was true. It requires exclusive breastfeeding for 6 months. It is true. And failure rate is around 15 to 20%. No, we have discussed failure rate will be less than 2%. So answer for this will be 2 and 3. Next, they were talking about laparoscopic tubal sterilization. So laparoscopic tubal sterilization can be done 6 weeks following the delivery. So answer for this is can be done after 6 weeks of delivery. If we talk about the medical termination of pregnancy, so we all were aware about the upgradation which happened in the latest edition. So what were the criteria for this is that termination is permitted up to 24 weeks of pregnancy, and second one, if the pregnancy exceeds 20 weeks, then we need opinions of 2 medical practitioners. So answer for this would be it was exceeding 20 weeks, so it is 2 registered medical practitioners. If I talk about the Combi pack which is approved by the DGHS for the MTP in the first trimester. So MTP, what they have said is mifepristone and misoprostol can be given. So it was the range. But if we talk about specifically Combi pack approved by DGHS, so answer for this is 200 milligram mifepristone and 800 microgram misoprostol. This is the question from Park, like history of public health. I don't know anyone would have solved this, but if would have put in logic behind solving this, they were asking कि following 4 distinct phases are there and you have to put the correct sequence in order of oldest to newest, है ना? So out of them, what would have come first? First, we would have tried to control the disease, then we would promote the health, then we will social engineering, and the last would have been health for all. This would be the recent and the last stage. So if we check out the Park edition, so they were giving changes concept in public health where disease control phase came first, then health promotional phase, then social engineering phase, and in the last health for all phase. So if we arrange this, so your answer will become 3, 2, 4 and 1. Next is again a controversy. Some people are saying it's handicap, some are saying disability. So let's see what is about concept of disability. So let's take an example here. Okay, if someone's accident happen, है ना? So that will be called disease. If in that accident he loses his foot, so that is called impairment, and because of that loss of foot he cannot walk, that is called disability. And if he is unemployed after that, then he is handicapped. What they were saying in the question is कि he met an accident, okay, he lost his right arm, fine, now he is not able to drive the car to reach the office. Because of that he has to hire the driver. His job has not been gone, he just have to take the support of driver to reach his office. That is, he is unable to function, है ना? He is employed. So the answer is going to be disability, not the handicap in this case. So answer is disability. Next, this was the tough question. I think you all should leave this because nobody can read in detail. As per the 2030 agenda for SDG, what is target 3.46? Now this is the health targets in SDG. So they were specifically asking you about 3.4. So what does 3.4 says? By 2030, there should be reduced by 1/3 premature mortality from non-communicable disease through prevention and treatment, and should promote mental health and well-being. So the answer was C in this case. It was that tough and that has to be leave, है ना? Just now I told you unemployed will be handicapped. He is going for his job, but instead of driving he is taking the help of a driver, so he cannot perform the function what is of that hand. Like what is the function of foot? To walk. What is the function of his hand? To drive, which he is unable to do, but he is going for his job. His job has not been gone, so it is disability, not handicap, right? Next is in a given set of condition. Now that was a very time consuming numerical, right? If you would have been solving that at that moment, it would easily take your 5 to 6 minutes. So what they were saying in this question is, they were saying that there was a population of 1000. Let's assume they were saying that in a given set of conditions, screening test has got 90% sensitivity, 90% specificity, and prevalence was given 10%. Now we have to calculate the positive predictive value. So if they are talking about percentage, so let's assume there was a population of 1000 in which they are saying prevalence is 10%. So that says that out of 1000 disease are present in 10%, that is 100, and 900 are going to be without disease, है ना. Now we will apply the sensitivity. Sensitivity will tell you how many of them have the disease. So 90% means they are diseased. So disease prevalence was 100, disease is 100. So if disease is suppose 100, so if we calculate 90% sensitivity, so true positive are 90 and negative are 10 out of this 100. And what is specificity? It will tell you okay, how many will be healthy. So out of 900 healthy, because they are talking about 90%, we will calculate true negative is 90% of 900. So it would be 810, and false positive is going to be 10% of 900, that is 90. So what is the formula for positive predictive value? True positive upon true positive plus false positive. If we put these values, our answer will come 50%. So answer for positive predictive value is 50% in this case. Next we have is again a numerical question where they were talking about attributable risk. Attributable risk we have discussed multiple times, and that should not be again wrong. Incidence in exposed minus incidence in non-exposed upon incidence in exposed into 100, as this is percentage. So if we put incidence in exposed, they were saying among heavy smokers 224 per 1 lakh person, while non-smoker were 10, and this was the death rate among these. So what was the incidence in exposed? It was 224. What was in non-exposed? It is 10. Again we will put 224, and answer will come the 95.5%. You don't have to get confused with this 74 value. Our formula was clear, which we discussed in the recent last minute also revision. के incident exposed, this much you have to put. So you have to use only 224 and 10 value. You have to just ignore this, and your answer will come around 95.5%. So again, that should also be correct. That the changes that the malarial parasite undergoes in the mosquito represent which of the following type of biological transmission. So if we talk about biological transmission, so it is of three type: propagative, cyclopropagative and cyclodevelopmental, है ना. So in that they were saying about malaria. So malaria comes under the cyclopropagative. If we talk about red flea, that is plague bacilli, it is the example of propagative. And if we talk about filaria parasite in culex or guinea worm in cyclops, then answer would be cyclodevelopmental. So they were talking about malaria, so our answer is going to be cyclopropagative. Next, again a numerical question. So what they were saying is, in a given population of 10,000, there were 30 cases of diabetes which were already present on 1st January 2025. That means it signifies they are old cases. And in the year 2025, 400 more cases developed diabetes. That means 400 are the new cases. And 10 cases of diabetes died in the same year. So from new cases, if we minus 10, so that will be the remaining live cases new which are present. And the death happened within that whole year. So which of the following are correct? So they were asking the four formulas from you basically. So if you calculate out the incidence, so incidence was new case about population at risk into 100. So new cases were 400. And what was the population at risk at that time? So population at risk will calculate 10,000 में से you need to deduct 30 cases because they were old cases. They were not the population at risk. So here it will be around 9,970. So 40 by 1,000. So they were giving 42, which is incorrect. If we talk about point end, so prevalence we have discussed with an example point versus period prevalence. So what does point says? It says number of all current cases, whether old and new, of a disease at one point of time. So if we put the values old and new, that is 30 plus 400 divided by population at risk at that time. So 10 have died, So it will become this. So answer was 42. If we talk about period prevalence, so they say number of existing cases old plus new divided by mid-interval population at risk. Here they were saying present at that same point of time how much are alive. So 10 were dead, so it was this. But here there is a mid-interval population, so it would be 10,000 in the denominator. So the answer is 43 here. And if we need to calculate the prevalence, so prevalence is old plus new divided by population at risk. So that was 43. So again it was a very time consuming option. So answer for this is period prevalence 43 by 1000. Now this was the easy one. Here they were saying reduced in population, eliminated from population. So they were talking related in terms of population. So regarding population would be only one thing, population attributable risk, right? Everything is for individual, है ना? This is for denominator. This is the like they are telling about the population and ask about population. So answer is population attributable risk. Next is from demographic cycle. They were talking about the late expanding. So if we see the stages of demographic cycle, so in the stage 3, they have asked previously that India comes under which stage. So at that time answer what late expanding है ना. This time what they have asked is कि late expanding में what does it indicate. So it did indicate death rate decline further and birth rate falls. So they have asked this time this. So answer would be B for this question. Next they were talking about sample registration system. So if you would have read this, again this was an important topic. So sample registration system is a dual record system which consists of continuous enumeration of birth and death at national and state level by an enumerator and an independent survey which is conducted every 6 months, not year. So they were saying it is a dual record system, yes. And they have framed this line, but instead of 6 months they have written every year, which makes this statement wrong. It covers the entire country too, and it has facilitated more reliable estimate of birth and death even at state level. That is also true. So they were asking which is not correct. So answer this is B, because instead of every year they should have written 6 months. Next they were talking about endometrial cycle. So endometrial cycle may, if we talk about, so there was a basal zone. So this basal zone is uninfluenced by hormone, and as such no cyclical changes are observed in this. And what we have here is if we talk about the secretory phase, then it has a sawtooth glandular epithelium, and stratum compactum contains the neck of the gland and it has dense stroma. While if you talk about proliferative phase, then it has pseudostratification. Let's see these statements. They were saying basal zone is uninfluenced by any hormone. So this is true. They were saying sawtooth epithelium is seen in secretory phase. This is also true. If they are saying stratum compactum contains mainly the glands and less stroma, which is wrong. It contains dense stroma. And pseudostratification was seen in proliferative phase. This is true. So answer for this question becomes 1, 2 and 4. Next they talk about gonadotropes. So if we talk about self-priming of gonadotropes, if there is lower GnRH pulse frequencies, then it will favor the FSH secretion, and the higher frequencies will favor the LH secretion. If the frequencies are lower, they will favor FSH. If the frequencies are higher, they will favor LH. So what they were saying is we have to find out the correct statement regarding self-priming. So lower one will favor FSH and higher one will favor LH. So answer for this is A. Next they were talking about acute pelvic inflammatory disease, and this topic is repeated multiple times. So if we go for the diagnostic criteria, as I have said, what is the minimum criteria for acute PID? There should be lower abdominal tenderness, adnexal tenderness and cervical motion tenderness. These are the minimum criteria required to diagnose the PID. Other than that, we can have additional criteria. So they were saying we have to find out the diagnostic criteria. Lower abdominal, yes. Adnexal, yes. Cervical motion, yes. Oral temperature can be, but it is not the definitive diagnostic. That can come under the additional one. So here, if there would have been 1, 2, 3 and 4, we would have gone with that. But here the best answer would be 1, 3 and 4. Next, we talk about genital TB. You would have easily done that if you would have remembered the notes properly. So genital TB mein we have discussed that mode of spread is 90% hematogenous, and which is the most common organ affected? Fallopian tube. It is 100%, not the ovary. So if we go with this here, so what they were saying is, if you just have this much of knowledge only, na, you would have solved this. So they were saying we need to find it the correct true regarding this. So the most common of mode of spread was hematogenous. Yes, that was 90%. Now what about the other statements? They were saying most common site of affection is ovary. Wrong. That was fallopian tube. Ma'am, what about this? The tobacco pouch appearance. Let's see about this. So abdominal ostium is patent to give it a appearance of tobacco pouch, है ना? So that should be patent instead of that. Instead of close, that should be patent to make it correct. And what about this? Genital TB occurs in 1 to 2% of patients who had pulmonary TB. That's clearly wrong, है ना? That should be at least 10 to 20% should be there. So genital TB occurs in 20% of patients who have pulmonary TB in adolescence. So the answer is going to be C for this case. What is the drug of choice for the treatment of chlamydia cervicitis? So that was again the easy one. It was the azithromycin. Secnidazole, we all know we give it in vaginitis, and metronidazole. See, I have discussed about the tobacco pouch. Just see, for tobacco pouch, the abdominal ostium should be patent, है ना, not closed. That's why this option was wrong. Now kid 6, in the last just day before, I have told you about mnemonic regarding all the STI kits, hai na? And I have told you the drug mnemonic also in that, and it came out in the exam. So about kit 6, I have told you there are 6 letters in kit 6. So there was yellow, and in low, that means it is a lower abdominal pain, and we have MCD, that is metronidazole, cefixime and doxycycline. So answer for this was A. Now the next question was most common site for vulvar carcinoma is. So vulvar carcinoma, if we talk about, they have never asked vulvar carcinoma before. So the most common site is labia majus followed by clitorius and minus. So answer for this is going to be labia majora. What about this? They have talked about radiotherapy. Now everybody reads carcinoma cervix, but this time they have asked something very weird regarding from that. They were asking point A and B in the radiotherapy. Okay, so let's read about that. So if we talk about the calculation of dose for CA cervix and radiotherapy, so point A if we talk about. So point A is 2 centimeter cephalic and 2 centimeter lateral to the external os. And this is the point of crossing of uterine artery and ureter. So what does point A denotes? It denotes crossing of uterine artery and ureter. Next time they can ask you point B. So if I talk about point B signifies the site of obturator gland. So answer is going to be for this is crossing of ureter by uterine artery. This was the tough one. I don't think anybody could have answered this question. We'll discuss about the cutoffs later. Let's please focus on the solutions of this question paper as the NEET PG is around the corner. So you can expect some questions directly from this in your NEET PG paper, है ना? Because of the pattern which was nearly matching the INI and NEET PG. And once we are done with this, then definitely I'll take all of your queries. Which one of the following states the diagnostic criteria for post-molar gestational trophoblastic neoplasia? है ना? So if we talk about the diagnostic criteria for post-molar gestational trophoblastic neoplasia, so they were saying that there should be more than 4 values of plateaued HCG over at least 3 weeks time, or there should be rise of HCG of more than 10% for more than 3 values over 2 weeks time. So in the question they have put up the second option, right? So rise of HCG value of more than 10% for more than 3 values over 2 weeks time is the correct answer for this. Next, Fothergill. Nobody could have marked this question wrong. It is the most repeated topic, है ना? So we have read this multiple times. Composite steps of Fothergill's operation. I have told you the mnemonic of Papa. In the case of father, there was father. So we call it by Papa. So preliminary DNC, amputation of cervix, plication of McInroth ligament in front of cervix, है ना? Then anterior colporrhaphy and colpoperineurrhaphy. So this time they just tricked you in some way. They said plication of McInroth ligament, but in front of cervix or behind the cervix. So it was in front of cervix, and we have amputation of cervix. So answer will become 1 and 4 in this case. Next is, they were talking about Primi Gravida came to the antenatal clinic for a routine antenatal visit. When should be screened for diabetes? See, first thing is rule that no matter when you come, we have to screen for it. You have the history or not. So early we have to do whenever she comes at the first time. And what is the criteria screening strategy suggested for gestational diabetes mellitus? So they said between 24 to 28 weeks. So it would answer be either early in pregnancy, or we should repeat at 24 to 28 week. We will not wait for 30 to 32 week, and we will not 9 to 11 or 32. The answer is early in pregnancy, or we can do it 24 to 28 week. Now again, this is a very controversial question. Pharma teacher is saying something else, gynae teacher is saying something else, and the psychiatry peoples are saying something else, है ना? So I will not fall into the controversy for this. Again I am saying, when the answer key is out within a week, if any changes happen in the answers, I'll tell you what is the final verdict by the UPSC people, है ना? Because from the OBG point of view, answer is different, and from the other point of view it is different. So let's see what they are saying. They are saying that she was Primi, she was 6 weeks, she is already on epileptic drugs since 2 years. What should we do next? She was consuming valproate. So some are saying answer should be A, some are saying answer should be B, है ना? So continue valproate, increase the dose, and explain her risk of teratogenicity. See, most teratogenic drug is valproate, we all know. So if we continue that, and if we increase the dose, which is dangerous for her, if I would have be at your place, so what be the safer zone? We'll not completely directly stop valproate, we'll taper the dose and we'll shift to the safer drugs. So we have read about the safer drugs, that epilepsy in pregnancy. If we talk about teratogenicity, so lamotrigine, levetiracetam or carbamazepine is the drug of first line choice. We should give this. So we will shift to the different drug and we'll taper the dose promptly. But here they are saying we should continue valproate and increase the dose. So increase the dose somehow make it wrong. If would have been the safer drug, we would have definitely increased the dose. Here I think better answer should be stop the valproate and start her on levetiracetam. So again, this is a controversial question. Answer can be A, answer can be B. It is 50-50%. So once the UPSC release the key, we'll go with that answer in the final. Next is, see, if we talk about the last year's key is released after the final result, but this time for the IAS also they release the key within a week. So there are probability that they will release it within a week. If that happens, so we will upgrade you with the answer changes if anything happens, right? The next step to follow for a mother with Rh negative pregnancy and antibody titer above the critical level. So RH negative mother, if we talk about, if we perform the ICT test and it came out to be negative, then we'll simply give NTD. But if it came out to be positive, we will do the we will measure the titer antibody, and if it is below the critical, then we will repeat the titer. If it is below the critical, no, then we will do the MCA PSV Doppler. And after this, if fetal anemia comes out, so we will do cordocentosis, and if there is no fetal anemia, we will continue the follow-up. So what is the answer for this question going to be? They were saying what is the next step if the titer is above the critical level. So answer is MCA PSV. Now abortion is predictable topic every year. So if you would have remember just one thing which I told you, okay, if we talk about open os versus closed os. So in the open os was there in the two cases, both start with I in inevitable, and in the case of what is the other I? So here we were having only one I, that is inevitable abortion. So answer in the case of dilated internos, A would go for 2. So A we were having 2, 2. Now we have to decide about the B. So B, they were saying there was a brownish vaginal discharge and there is no fetal heart sound on ultrasound. So that comes out to be missed abortion. So if you would have remembered the table of the incomplete, inevitable, threatened abortion, so we know where the brownish color is seen in the missed abortion, the cervix is closed and there is no cardiac activity. So if you could rule out only two things, that is A2, B1, your answer would be this. You don't have to go for C and D in that case then. Now next is early onset fetal growth restriction is diagnosed before. So if early onset fetal growth restriction is before 32 weeks and late onset is after 32 weeks. So answer is going to be 32 weeks of gestation. Next they were talking about vaginal epithelium in adult female. So if we read vaginal epithelium in adult female, so if we go from puberty till menopause, the vaginal epithelium is non-keratinized stratified squamous epithelium and it is devoid of any gland. There is no gland present from puberty to menopause. And if we talk about intermediate and superficial cells, then they contain glycogen, not the basal cell. And these cells become continuous with those covering the vaginal portion of cervix and they extend up to the squamocolumnar junction. And unlike the skin, vagina does not contain hair follicle, sweat and sebaceous gland. So the answer for this is, they were saying puberty till menopause is devoid of any gland, that is true. Basal epithelial layer contains glycogen, that is wrong. Superficial and intermediate layer contains. Intermediate and superficial become continuous, yes. Unlike skin, it does not contain hair follicle, yes. So the answer for this is 1, 3 and 4. Next they were saying is, which of the following statement is true regarding neurovascular anatomy of the uterus? So blood supply of uterus, they have previously been asking about the arterial supply, which was mainly from the uterine artery and from ovarian and vaginal artery. This time they have asked the venous drainage. So venous drainage is drained into the internal iliac vein. If you would have known this much, you would have solved this question. So blood supply of uterus. So they were saying you have to find out the correct statement. So venous channel of the uterus is in the internal iliac vein. That is true. Anna, let's rule out the other option. So they were saying from the they supply the uterine artery which arises from anterior division of external iliac artery, which is wrong. It is the anterior division of internal iliac, not the external iliac. Next they were saying uterine artery crosses the ureter 3.5 cm lateral to internal os. No, the uterine artery crosses the ureter anteriorly, not laterally. And somatic distribution for uterine pain is, we have by T10 to L1, not T5 to T6. But if you would have this much knowledge, the arterial supply and venous drainage, then the answer was simple, it is internal iliac vein. And here it is not external, it is internal iliac artery. Next again, this you could have done. They were talking about the embryonic structure and the developed organ. So we have discussed this, that if we talk about paramesonephric duct, so uterus is derived from that. If we talk about mesonephric duct, so we have vesicles, prostatic urethra from that. If we talk about genital tubercle, so we have clitoris derived from that. And if we talk about round ligament, so that is derived from the gubernaculum. So we put all these values here, so the answer will become C, that is A3, B1, C4 and D2. Next question was, when does the secondary oocyte complete the second meiotic division? So this was the gametogenesis which was shared with you all. So if we talk about completion of first meiotic division, then it happens before ovulation. If we talk about completion of second meiotic division, then it happens after the fertilization. So when is the second meiotic division completing? It is completing just after the fertilization. Now here just the presence of mind required, growth and differentiation of follicles. Follicles, which hormone will control? Follicular stimulating hormone will manage the follicles, right? So answer for this is B. Next they were asking, which of the following fertility related statistics most appropriately gives the approximate magnitude of completed family size? So if we talk about total fertility rate, this measure gives us the approximate magnitude of complete family size. So answer for this is total fertility rate. A person had undergone the serology for suspected hepatitis B infection. There was presence of HBs antigen, IgG anti-HBC, presence of anti-HBe, but HB antigen was negative. Now what would be the answer in this case? So if you remember this, so there if we students were confused among high infectivity and low infectivity. So in both cases HBs antigen would be there. But HBe antigen presence will make it high infectivity, its absence make it low infectivity. So HB antigen was absent in this case, so it will become low infectivity. So answer for this is low viral replication. Next was regarding the malaria survey, and they were asking the definition of inoculation rate. So there are multiple definitions given. If we talk about the inoculation rate, then inoculation rate means the men biting rate multiplied by the infective sporocyte rate is known as the inoculation rate. So the answer for this is going to be C. Next, it is about the rabies. Here they were saying that there was an 8-year-old boy who has just been bitten by a monkey, and the children was in the forearm bitten, and blood is visible over the wound, and the nearest health facility is 3 kilometers away. What they should do, so this is a category 3 bite as the blood is visible. So yes, it is a category 3 bite. Then also you will start with the washing the wound with plenty of soap and running water for at least 15 minutes. That should be your starting point. So answer should be 2 only, because here they are saying you should rush to the health facility without waiting for anything. No matter where this case happen, if something like this happen, you have to first wash the wound so that it doesn't get spread fastly. So one was incorrect. And what about the fourth one? They were saying advise the mother to seek treatment for the boy's wound, but the boy required no treatment or prophylaxis as it a monkey bite. No, this is wrong. It requires the treatment because it comes under the rabies. Next they have talked about the Horrocks apparatus. So Horrocks apparatus may we all know it is for what used, but now they have in NEET PG this is frequently asked. So we have to need the calculate that they were saying the third cup showed the distinct blue color. So if we do the procedure of the Horrocks operator, so they say suppose the third cup shows the blue color, then 3 level spoonfuls. That is, for every cup there is 2 gram. If the second cup shows the blue color, the answer will become 4 grams of bleaching powder. Here the third cup was showing this, so answer will become 6 gram. If the fourth cup would have shown this, then answer would have become 8 gram. है ना? For each cup we have 2 gram. So it was in the third cup, so answer will become 6 gram. Again, nobody would have answered this. To be effective, the size of opening in the mosquito net. So the size of opening in the mosquito net should not exceed 0.0475 inch. है ना? They have confused by giving inch and centimeter in the options. So we will go with 0.0475 inch in diameters as the answer. Next, they were asking about the WHO expert group, the cutoff for the hemoglobin in adult males. So what we have read is cutoff point for the diagnosis of anemia. If we talk about adult male, the cutoff is 13. If we talk about adults females pregnant, it is 11. So the answer here will become 13 gram per DL. Next question was, they have given the history where you have 3D. You have diarrhea, you have dermatitis, and you have dementia. What does 3D tells us? 3D tells us about the deficiency of niacin, vitamin B3, that is pellagra. So you have to think in terms of niacin deficiency, that is pellagra in this case. So they were saying which of the following are correct regarding this. So we should avoid milk in the child diet, or we should encourage shift of cereal consumption from sorghum to maize. See, maize should be avoided, and we should instead give the sorghum diet to the niacin patients. So 2 is completely incorrect. We should provide meat, or we should give the supplementation with nicotinic acid. These 2 were correct. So answer will become 3 and 4. Next, they were talking about National Blindness and Visual Impairment Survey, which is the most common cause of blindness in India. If we look at the causes of blindness in India according to the survey, then 66% are the cases of cataract untreated, which forms the majority here. So answer for this is going to be cataract untreated. Next, they were talking about tracking phenomena of blood pressure. So we talk about tracking phenomena of blood pressure. What does it tell? If the blood pressure level of individual is followed over a period of years from childhood to adult life, and those individuals whose pressure were initially high in the distribution would probably continue in the same track as adult. This what it says. And the phenomenon of persistence of rank order of blood pressure is described as tracking. So the answer for this is persistence of rank order of blood pressure in individual as they grow older. Now next was regarding BMI. So I have taught you how to calculate BMI. We have 70 kg weight and this was the height. So we will divide weight by the height ka square. So we were having weight as 80 kg and height was 1.6. So we will put a square here. So we will get 31.25 as the answer. But now you have to classify that too, in which category it will come. So 31.25 will come under the obese class 1. So this time questions were not direct. Previously they directly ask you in which category it is, or they will ask you what is BMI. Now this time it was more USMLE pattern. They were asking step by step. Like in the same question you have to apply 2-3 concepts, which is time consuming, which is lengthy, and which is quite tricky. So paper was not easy. It was time consuming, and let the cutoff decide what it goes. So answer for this is obese class 1. Now this was regarding pneumoconiasis. So we all know in silicosis what we have is, we have snowstorm appearance. So they were asking snowstorm appearance. So snowstorm appearance was seen in silicosis. Now next, last year they talked about occupational cancer, in which they have framed nickel chromium work and these as the options. This time they have asked leukemia specifically, that which of the following cause is by which exposure leads to leukemia. So caused by exposure to benzene, Roentgen ray and radioactive substance. So answer is benzene in this case. So we'll go for benzol. Now this was regarding sex chromosome. It was tough. I think nobody would have known this. So X chromosome is included in group C while Y chromosome is included in group G. So this time they have asked you the X chromosome, next time they can ask you the Y chromosome. So this time the answer is A for this question. See, UPSC has finished, but you cannot ask for the time for the NEET PG also. They have kept the same time but decreased the number of questions. So you can imagine the length of the questions, how they are going to be in the main exam. है ना? So now they are not testing the knowledge, now they are testing how fast you can read the question and how fast you can filter out the option. So you need to practice multiple questions to master that, है ना? There is a 1 month time for you for NEET PG. So practice more lengthy questions and clinical vignette type of questions so that you can manage in the main exam day. Consider the following organization of importance in the history of international health. So you need to arrange them in the history of international health, which came oldest and which is new. Out of them, what you study, you are studying World Health Organization. You have not heard about these names. That is, in the current practice, there is WHO. So out of the four, only in fourth option, fourth was coming in last. You would have done this by this thought. Otherwise, if we go through the theory pattern, so according to theory pattern, what does this say is, first comes the Pan American Sanitary, then comes the Official International Hygiene, then comes the Health Organization of League of Nations, then came the United Nations Relief, and in the last came the WHO. So you are aware of WHO out of them, that means that is the current going one. So in the fourth we have WHO, we will go with this. They were asking about which among the following terms best fits the description the entire gamut of preventive therapeutic. Again, this was from the topic which you must have not read before. So this was regarding the definition of social defense. Social defense covers the entire gamut of preventive therapeutic and rehabilitative service for the protection of society from antisocial, criminal and deviant conduct of men. So answer for this is going to be social defense. Again they have asked, we used to learn about the adverse event following immunization, that what drug causes what. Now they have upgraded their level. They were saying there was a 10-week-old infant, but this was logical. If you read the question by the presence of mind, you would reach to the answer. There was a 10-week-old infant and he has taken all the doses before. That is, at 6 weeks he has taken the vaccine, and he has also taken 3 days before pentavalent and the rotavirus vaccine, and now after 3 days of taking vaccine he is having the episode of epilepsy. But 2 epileptic episode in the week has already been there prior to immunization. That means those epileptic episodes are not related to the immunization because they happened prior to immunization also. So they were saying which of the statement is correct regarding adverse event. It is vaccine product related? No, because it happened before also. It is immunization error? No. It is immunization stress? No. It is a coincidental event which happened. And there is no relation of vaccine with the episodes of epilepsy. So the answer is going to be the D. It is a coincidental event. Which of the following are correctly represent the basic criteria for identifying? I think screen is not visible to you all. Just a sec. See, they are framing these type of questions because they know what you already know. Is my screen visible now? Is this screen visible to you all now? So the next 58 question. Which of the following correctly represent the basic criteria for identifying at-risk infant? So we have discussed this, the criteria to identify the high-risk infant, है ना? It should be birth weight less than 2.5 kg, twins, birth order 5 and more. In the question they have given 3 and more, which is incorrect. Birth order is 5 and more, or if he is on artificial feeding, है ना? So these are the criteria to identify high risk infant. So the answer was birth order 3 and above, which is incorrect. Rest all 3 comes under the high risk. Next, they were talking about mass drug administration for elimination of lymphatic filariasis. So in mass drug administration of lymphatic filariasis, we either give ivermectin or we give DEC plus albendazole. These are the 3 drugs which is preferred in the case of treating of MDA of lymphatic filariasis. So answer is 1, 2 and 3 in this case. Next, this was predicted as it has got updated in the last edition, and we have discussed in the high topic also, malaria elimination 2016 to 2030. So what does it say is, it says by the year 2027, indigenous transmission of malaria should be interrupted. An entire country should have no indigenous cases and no death. And by the year 2030, the entire country should sustain status of that zero indigenous case and death for at least 3 consecutive years. So here these all were something related to the 2007 data before, है ना, 2022 and 2024. So they were asked about 2027. So the answer for this is the entire country to have no indigenous case and no death due to malaria. I have discussed this in the PSM update about the Nal Jal Yojana, which is also known as Jal Jeevan Mission. What they have asked is that the goal is to provide every rural household with a functional household tap connection that delivers at least 55 litre of tap water per person. This was the new entity which was added in the Park 20th edition, and they framed the question from here, and the answer was 55. Next, they were talking about live vaccines. Again, this was an easy question. So we know how to classify the vaccines under what group. So if we talk about live attenuated, we were having measles, OPV, yellow fever under the group of live vaccine, as IPV was killed and here IPV plague both were killed, right? Now this was the very confusing, even I got confused in the first attempt. That was a brainstorming question actually. So they gave you a story, on the basis of that you need to make up the diagnosis. So they were saying there was a 6-week-old infant and has a history of fever for 2 days, and according to the mother he is not feeding well, but at least he is taking 2 to 3 breastfeeds per day. An infant is also having diarrhea and sunken eyes. Now pus is coming out from the umbilicus and the respiratory rate is this. And in this one question they are asking you the knowledge of the 2 table. Either you will frame this under the dehydration or you will frame this under the case of bacterial infection. So let's look at that. If we classify it according to the dehydration, what does definition of severe dehydration says? There should be at least 2 of the following signs. Either there should be movements only when stimulated or no movement at all. They have not talked about movement in this question. Sunken eyes, yes, it is present. Skin pinch, they have not talked about that. Only one feature will not make it severe dehydration. To say severe dehydration, we should have 2 signs, which we are not having. So it is not severe dehydration. To say it is some dehydration, we should have restless, irritable, or the sunken eyes. Again only sunken eyes was there. So again it is not the case. And to say no dehydration, there should be not enough signs to classify as some or severe dehydration. If we talk about only sunken eyes and all, yes, no dehydration can be the possibility. But if we look at the other features, like to say classify it under the possible serious bacterial infection or very severe disease, it should be not feeding at all, but he was feeding, he was taking 2 to 3 breastfeed. So not feeding well is also the criteria. Number one is fulfilled. Is he was having fast breathing? No. Fast breathing, to call it fast breathing, it should be more than 60, but it is around 55, so that is not true. Severe chest indrawing, they are not talking, but the child was having fever, so it will be fulfilled here. So we are having, and the criteria says at least one or more than one, so we are having two criteria fulfilling here to place it under the case of very severe disease. And the next option was local bacterial infection, and he was having umbilicus draining pus. But as the MNCI says, we have to pick up the severe grade. So if we go with the local bacterial infection, so we would have sent that child at home, which would have been dangerous for him, because he is dehydrated, he is not feeding, and he is having fever. So the better answer for this is going to be give him the first dose of intramuscular ampicillin and then refer to him urgently to hospital. So this is very severe disease, and how we will treat it? We will treat it by giving the first dose of antibiotics. We'll refer to him hospital urgently, and because he was dehydrated, so we will give ORS also. This was, if the answer would have been local bacterial infection, then answer 4 would have been correct. But this was the case under the very severe disease. So the answer for this is C. Again, they have picked up the paragraph from the park and they have framed 5 questions out of that. They were saying that there was a female who is poor migrant worker, and she has been recently moved into the village with his husband. Now the Asha of that village visit to her, and she got to know that she is not having menses from January. So January to March, approx 2 months has been already happened, and she was 28 years. Her height was 144, her weight is 52, and hemoglobin was 11.6. On the basis of this knowledge, we have to solve 4 to 5 questions out of that then. Now this was easy. That what is the pregnancy kit is known as? So we all know this is for tuberculosis, and Nishchay kit we use this as a pregnancy testing kit. So the answer for this one is Nishchay kit. That was easy. Next, what they were saying is, for the once the pregnancy is confirmed, now how will you register the pregnancy? So I have told you in the antenatal care that registration of pregnancy should be done within 12 weeks, and that too be done by A&M. So the answer for this is, it should be done within 12 weeks and it should be done by A&M. So the answer for this is going to be 1 and 4. Next they were saying is about iron folic acid supplementation. That also I have told you that 180 doses of iron folic supplements has to be taken by the pregnant and lactating woman during ANC and PNC period. So they were asking how many days she should consume the iron folic acid supplementation. We take 1 iron folic acid per day. So there were 180 doses which she has to take. So it will be 180 here. Next they were talking about the high risk pregnancy risk approach. That too I have told you, like the antenatal care basically they have asked you, and I framed all these. If you check out the notes, all these things are given in an order. So high risk cases according to the park, if we talk about, she should be elderly primary to called high risk case. Her age was 28, so she is not high risk on that basis. They are saying to short statured primary is 140 centimeter and below. She was around 144 or 145 centimeter. So she is not short statured also. She is anemia. Her hemoglobin was around 11.6 something. To call anemia, that should be less than 11. So according to age, she is not high risk, because age, what is her age is 28. To call this high risk, that is 30. According to height, to call it high risk, height should be less than 140 centimeter, and here the height was 144. And hemoglobin level, her hemoglobin was 11.8. To call high risk, that should be less than 11. So answer would be none of the above in this case. Consider the following advices to be given by the ASHA to Mrs. M, assuming pregnancy has been confirmed. C. Please take this session as a learning session. This is not a promoting section or something. Like, this is not, I am here to tell you that this is from Madura, you should have answered it. I am just discussing, and you should learn from this session that what is the correct answer and why is the correct answer, and apply that information in the NEET PG if that question comes from that. है ना? This is not something कि I am promoting any course or something. I have kept the monetization off for this video, so that in discussion no ads or something play in between to hamper your learning, right? So take it in that way and just learn the things and just move away with your NEET PG preparation. This is just a discussion session, okay? I am not here to say that go for this course or go for that course. Every platform is best at their place, and everyone tries to do their best at their place. So let's take this as a healthy discussion. I want the answers from your side, that what you think should be the right answer. So we are just taking a discussion round on this. Instead of going from multiple PDFs, let's disc out the cutout from the books and something, and let's get to the right answer. That is the main goal, okay? So let's take the discussion as a healthy discussion. Consider the following advices to be given by the ASHA to Mrs. M. So we don't know anything about it, but just look at the question. They are saying minimum 12 hours sleep at a stretch at night. So nobody, for anyone, this 12 hours sleep is not good. We always say 8 hours sleep is the healthy criteria for the sleeping, right? So we'll go for 8 hours. So this is wrong. Avoid resting immediately. Everybody says just after having the meal you should not rest. You should either take a walk, or like immediately should not be rested, whether you are pregnant or not. So this is also avoided. Avoid intake of extra fluid to avoid constipation. To avoid constipation you should take more fluids, right? So this is also wrong. Avoid taking purgatives like I think this one I have marked wrong. See, avoid resting immediate. This was true. Na, we should avoid. Okay, avoid taking purgatives like castor oil to relieve constipation. Yes, we should not take any kind of purgatives as she is pregnant. These things can hamper her pregnancy. So 2 and 4 are correct. So we will go for 2 in this case. Only 2 statements were correct in this. Within a month result would be out. So just after NEET PG, get prepared for the result. So TRICE system. So TRICE system, you previously they used to frame it like easily. They give you a situation and ask you in which color it would fit. This time they have asked you the TRICE system in terms of you have to arrange in terms of high priority. So we all know the TRICE system. Red indicates the high priority, then comes yellow, then comes green, and the last is for black. So this was required you to arrange in this question. So the answer for this is C. 3, 4, 2 and 1. So this was regarding the classification of wound. So they are saying that the patient presents to you in the emergency with a foul smelling wound on his left foot. On examination they were having maggots with a lot of necrotic tissue. So we heard about clean, contaminated and dirty wound. This is also known as class 1, class 2, class 3 and class 4. So if this kind of necrosis is happening, this type of maggots are there, do you think it is a clean wound? No. Do you think it is clean contaminated? No. It is just contaminated or it is dirty. It is dirty and infected wound. We are having necrosis, we are having maggots, we are having foul smelly. So it becomes class 4 wound classification, that is dirty infected wound. Next, they have asked something which nobody have discussed before. Which one of the following is not a wound prone to the development of tetanus? If we talk about Levin Valley, we have a table there regarding tetanus prone wounds. So tetanus prone wounds are when you have any kind of bite, when you have any kind of compound fracture, or you have contamination with soil. So these are the other causes which are of tetanus prone wounds. So here we were having compound fracture, it is wound prone. We were having contamination with soil, yes. We are having bite, yes. Donor site of a split thickness skin graft, it is not the wound prone to the development of tetanus. If we don't have knowledge about this table also, so by the common sense they were saying कि tetanus में we all know soil से होगा, बाइट से भी देर आर चांसेस, फ्रैक्चर से भी इन्फेक्शन अंदर जाएगा. But if we are performing any surgery in the operation theaters in a full precautions, so obviously बात है by common sense this would you easily have been ruled out. So the answer would be C in this case. Next is they were talking about surgical site infection, and that too major surgical sites infection. Again this was a table like they don't, UPSC people, as I said, from no coaching institute that question paper is framed. That question paper is framed from the standard textbooks. If they are framing surgery questions, they will frame from the Levin Belly. No question of surgery was out of the Levin Belly, and same happened with other subjects too. So even if a small table is there, they will ask you that too. So even they have, with this 3 option, they have not left this table. They frame the question out of this. I think there is again a screen issue, just a sec. See, they should have mentioned unsterilized, है ना? If we look all of the 4 options, so assuming that it can be unsterilized would be not the safer one. But again, as I said, that paper was unpredictable. So if you are doing these kind of mistakes, that is acceptable, है ना? It is not like the previously repeated topic and you made that silly mistake. I would say don't run behind what will be the cutoff. I don't know why it is not stop supporting. I think you all are not liking the discussion, so the screen also left the support. See, just after NEET PG, the result will come. So you should focus more on the NEET PG preparation. है ना? Again, I am saying if you are 300 plus, you are definitely safe. And if you are 250 plus, then you are not out, not in. You will be in a risk zone. You can be called up for interview, but again, as I said, the main list matters more. So in this question, they were saying that all of the following are the features of major surgical site infection. As I said, the UPSC people are in love with Levin Belly, है ना? So there was one summary box which only contains 3 points, and they framed the question out of that. They were saying major wound infection. So major wound infection is if it has significant quantity of pus, delayed return home, and patients are systemically ill. So they have put all these options beautifully here. It was significant amount of pus, is what delayed return home, and patients are being systematically ill. So answer would be excessive pain at the surgical site, which is the except 1 years. Now this should be done correct. Cystic hygroma has been asked before, and I have also teach you that it presents in the early age, and cysts are filled with clear lymph, and the swelling is bilateral like this, as you can see in the image, and it is soft, and it is brilliantly transilluminant, and it is compressible partially. But so when we look at the question, there was infant, he was having swelling in the neck since birth, it was soft, it was partially compressible, it was brilliantly transilluminant. So no doubt answer would be a cystic hygroma. Now which of the following, see, I have told you multiple times that this table was ultra important. They can frame any questions out of that. That last year they were asking about Lee-Fraumoni syndrome, and they were framed 4 statements out of that. This time they have used this table completely, and out of each point they have framed 1 line. First they are saying that pituitary tumors are seen in men type 1. So in men type 1 we have 3 P's. We have parathyroid, we have pancreas, and we have pituitary. So this is correct. Next they have said that Lee-Fraumoni syndrome has brain tumors. So Lee-Fraumoni syndromes have brain tumor. Next they are saying prostate cancer is seen in familial breast cancer syndrome. So in familial breast cancer syndrome, apart from breast, ovary, papillary serous, we also have prostate cancer. So this is also true. And last was FAB syndrome. In that we don't have breast cancer. That was here in the table, which I have not attached. So C is incorrect. Breast cancer is not associated with FAB syndrome. Okay, I am not visible. Just a sec. Thank you for notifying it. Okay, is everything correct? Fine now? This screen is not in your favor. Now the next question, they were talking about secondary lymph edema. Okay, everything is fine now. So this was regarding the causes of secondary lymphedema. I think either you people are not enjoying or something is not in our favor. Someone is jealous with the discussion. So the screen is creating so much of chaos for today. Which of the following are the causes of secondary lymphedema? So classification of lymphedema, if you would have remember, primary versus secondary. So what does lymphedema means? There is some kind of lymphatic dysfunction. There is some kind of obstruction or something in the case of lymphatic drainage, है ना? So in primary lymphedema, that is from the genetic, and in secondary it would have been acquired later on. Initially it was working fine, and later on that developed. That simply means secondary. So which of the following are the secondary causes of secondary lymphedema? See, it doesn't matter code A or C. You just learn about the solutions, and you can just simply mark the answer. I was having paper D, so I have marked according to that. So out of options, you have made one thing clear, that all 4 are not correct. You need to find out the incorrect one. So trauma can happen later on. Deep vein thrombosis is not congenital or genetically, it happens later on. And among fungal and viral infection, so fungal infection are more likely that will affect your lymphatic system. So 1, 2 and 3 are correct, है ना? Viral infection is not correct. Now many students got confused with this too, acute embolic occlusion. They were just asking about the acute arterial occlusion, where we have discussed the 5 P's of acute limb ischemia. What is 5 P's? Pain, pallor, paresthesia, paralysis and pulselessness. So here we were having pain, we were having paralysis, we were having pulselessness. What is not there? Purple discoloration. So the answer for this is, what was accept? Answer is this. You have to apply the knowledge of 5P in this question. Now whatever the images came in this exam were all from Love and Belly, है ना? So next time if we prepare, so we know what we have to prepare. We just have to go all the images which are available in the standard textbook, so that the image based answers got easily solved, है ना? So these were the shapes of edges of ulcer according to Love and Belly, and they asked us in the exam about the image B. And what does image B says? Image B says tuberculosis. And there were the other images and the names. So this image matches with the case of tuberculosis. So there were 5 images. If we talk about first image, this edge of ulcer is the non-specific ulcer because it is having the shelving edges. This one is of tuberculosis because there are undetermined edges. In case of C, there was basal cell carcinoma because it is a rodent ulcer and there are rolled edges. What about D? D is under the case of epithelioma because there is a heaped up or everted edges. And what is about the last picture? It is seen in syphilis because in syphilis we have the punched out edge with a thin base and which may be covered with a washed leather slough later on. So that this time the answer was tuberculosis. Now this was again a common sense question. They were asking that if a patient has undergone the surgery for the removal of a benign tumor from the parotid gland, which of the following structure should be preserved during this surgery? If we talk about anything which is related to parotid gland, so parotid gland is divided into 2 parts, superficial and deep lobe. By which it is divided? It is divided by facial nerve. So if we do any kind of surgery near the parotid gland, what is the first thing which need to preserve? We need to preserve facial nerve. Again, the previous year they have framed the question regarding erythroplakia, leukoplakia, and later on they asked about if there is some kind of ulcer present. So what is going to be the next? Last year also the answer was edge biopsy. This time also they are saying the age is 52, which is a risk. He is having non-healing ulcer, and he is a smoker. So that means he has the chance of having the oral cancer. So what we will do is, if he is having the non-healing ulcer, X-ray would be of no use. We should not treat it. We should first make a diagnosis and we should try to rule out the cancer. So edge biopsy of ulcer. This was the easy one. Now again here they were saying that there was a 42-year lady undergone the laparoscopic cholecystectomy, and it was having some spillage of bile and gallstones during dissection. Post-operatively, she started complaining of right shoulder tip pain. We all know shoulder tip pain. What does it denote? It denotes phrenic nerve, and phrenic nerve get damaged somewhere around. It is related to diaphragm, and she was having fever and these things. You have to make up the diagnosis. So if you talk about ascending cholangitis, we have Charcot-Trie, and Charcot-Trie is not fitting here. This is something related to phrenic nerve shoulder tip pain, which we get in right subdiaphragmatic abscess. So it is C answer. Now this was the image directly taken up from the Love and Belly. They were saying there was a swelling in the left groin, and what is this procedure being done? So procedure being done is, this is called Lichtenstein's repair. We have learned about tension free repair and the tissue repair. They were previously asking these things. Now they have upgraded themselves and they started asking the image based questions. So for this time the answer was Lichtenstein's repair. TB was the correct one. See the image. This image matches with this, and this is of tuberculosis. Next is 83. So they were saying that patient of a blunt trauma to the abdomen is being explored in the emergency, and intraoperatively a non-expanding hematoma was seen, which is lifting the descending colon. What should we do? See, if there is blunt trauma which has happened, so we have retroperitoneal hematoma zones. There are 3 zones. One is in central, other one is in the lateral, and third one is in pelvic. So if we are having the damage in the central area, so it would be, we should explore always. What should be the disorder repair? See, this is the direct image from love and belly, and this is exactly matches with this. So answer is Listensen repair. So if we talk about the retroperitoneal hematoma zones, so if there is in the central zone, that is if it is damaging aorta IVC, in that case we will explore always. If it is a blunt trauma, here what we were having is blunt trauma. If it is lateral, that is kidneys ascending or descending colon, if that is the location, so we will only explore if it is expanding or pulsatile. And if it is in the pelvic area, we do not explore. Where it was happening, it was lifting the descending colon, that is the second one. So we are going to explore the hematoma, but it was just lifting up the colon. It has no relation with colon, it is not intruding or something, colon has not been damaged. So why we will open it? So we will do nothing to colon, we will just explore the hematoma. Now this was the image. I don't think anybody should make this wrong. We have learned what is horseshoe kidney. In horseshoe kidney, the lower poles are fusing with each other, and that its ascent is restricted by inferior mesenteric artery. And if we do the eye view, then we have the handshake sign, or known as flower vase sign. So here, if we talk about the love and belly, they have picked up the same image. The kidney are shaking their hands, the lower poles are fused, and what they have asked in the question, the same image. So the answer for this is horseshoe kidney. Again, they picked up the diagram from the love and belly. Principle of adaptation shown in the following diagram is explained by. So this is about the Monro-Kelly's doctrine, which accounts for the ability of intracranial compartment to accommodate the expanding mass lesions. So the image was matching with this exactly. So the answer is going to be Monro-Kelly doctrine. Astrocytomas are associated with all of the following syndromes except. See, they have asked this type of question previously also, so this was an repeat, I should say. Previously they asked which of the following abnormalities is not associated with which chromosomal abnormality are associated with brain tumors. So at that time answer was NF1, NF2 and HNPCC. This time they have asked which tumor is not associated with astrocytoma. So only NF2 is the one which is not associated with astrocytoma. Rest all 4 are associated with astrocytoma. So answer this is B. So they repeat the topic, but they frame the different question out of that. So if you would have done this table at that time, so you would have easily figured out that astrocytoma was something which is missing out in this case. Again, an image from love and belly. So what they are doing is the exact same image. So this was the incision in a cricothyroidotomy. Insertion of tube after cricothyroidotomy. So only one option contains cricothyroidotomy. So answer was this. This image was depicting this picture. Next question was regarding flail chest. I have taught you flail chest, but I have just taught you one thing only, that what is flail chest definition. So it was 3 or more ribs fractured in 2 or more places. This time they have framed whole paragraph out of that. So if we read about flail chest, We know the definition that 3 or more ribs fractured in 2 or more places. So this statement is correct. Next is there is paradoxical motion of a chest wall segment. The CT segment remains the gold standard. Now if you don't have any idea about flail chest, then also you would have easily ruled out the third one. X-ray can never be gold standard for diagnosis. This was the easiest one to rule out among all. You know about this, but if you have read here about the gold standard, then X-ray can never be. If it would have been CT, MRI, if you are confusing with that, that's fine. But X-ray you should not confuse with gold standard. We have CT scan as the gold standard. And how do we treat that? We'll treat by oxygen administration, adequate analgesia, and the physiotherapy. Next question, again a table from Love and Bailey. All of the following are causes of secondary osteoarthritis of hip. So these were the etiology of osteoarthritis. In the option they mentioned trauma, they mentioned avascular necrosis, they mentioned Perthes disease. So the diabetes was the one which you need to rule out. See, the paper was tough, but this was a direct repeat. What are the differential diagnoses of acute red eye? See, this paper tests two things. You should not make the questions wrong, which you should do correct if it is a repeat. And the second thing is try to rule out the answer by your presence of mind. You don't have to do like nobody knows the net size of mosquito. Nobody would have answered that and nobody would have read that. And there are multiple questions regarding that. But if the person has done the question wrong, something like this, then he will be out of the race. If he is doing questions wrong, which have never been asked before, new, that's all right. But you should not miss out on the questions which are a direct repeat. So differential diagnosis of acute red eye. So we all know keratitis, uveitis, episcleritis. So the odd one out here is retinitis. This was a direct image picked up from Love and Bailey which suggests cricothyroidotomy. See what they are doing here in the image. They are putting the that tracheostomy tube inside. Now look at this. That was the exactly same picture. Now this you should have also done correct. Which scan is this which we are doing in the thyroid? You have seen the MRI scan, you have seen the CT scan, and you have seen the PET scan. In thyroid what we do is radionuclide scan. So this should not be wrong. Now this was again an interesting one. We always have read about the triple assessment, right? So in triple assessment what we do is, see about that hematoma question, I didn't get that answer from the Love and Bailey, and I searched the whole book. There is nothing being discussed about hematoma, so I'm not sure about that question. That answer could be anything of that. So when the final answer key comes, then we'll take that as the final answer. I'm in a doubt for that question. Triple assessment, if we talk about, we have three things: clinical, imaging, and pathology. We do history examination, we do ultrasonography, mammography, and we do core biopsy. So if we think in that way, then all four are correct. But they are saying that female is 29-year-old and she is having a discharge from the nipple of the breast. What will you not do in the initial assessment? Do you do mammography in the age of 29 years? No. At that age, you can do the clinical examination, you can do the histocytopathology, and you can do the ultrasonography. Mammography is not done in that young age. So that is ruled out. Again, the TNM staging of breast cancer is ultra important. So the tumor size was 4x6, and we all know that if it is more than 5 cm, it is T3. Now the next thing they are talking about is that it is fixed to the pectoralis major muscle but not to the skin. So it will not enter in the case of T4. It is the CT3 in this case. Next is about choledochal cyst. So choledochal cyst, first they are saying that it is a congenital dilation, which can be true. Now, if you look at the second question, majority of patients are diagnosed after 10 years if something is present congenitally. So, it will be diagnosed before 10 years, not after 10 years. And later on, that cyst can be converted into carcinoma. And radical excision is the treat. Yes, you will excise that cyst, right? Yes, you will do histo and cytopathology. You will take the biopsy. Cytopathology is preferred whenever if someone says there is a lump in the breast or anything. So we do FNAC first, as it is cheap, है ना, and memo is expensive. So we go in that order also, and her age was 29. You will not do memo, that is for sure. And FNAC can be performed even in the age of 12 years, 15 years. There is no contraindication of age in that case. So if we talk about choledochal cyst, so it is a congenital dilatation, patient present before the age of 10 years, and it has the risk of cholangiocarcinoma. And what is the treatment of choice? Radical excision. I have shared the table of astrocytoma, I guess. I don't think I need to prove anything more to you all now. Now again, that's a repeated question, direct repeated. Hemangioma is the most common benign liver lesion, has come before and we have discussed this also. So this time this was the easy one. They asked most common benign liver lesion. So the answer is hemangioma. Now this again, that was an image based question, but you have read about the intussusception before, है ना? In intussusception, what I have told you is that the entering or the inner tube is known as intussusceptum, while the outer tube is known as suscipiens. So in this case, they was asking about this tube. This is entering. So what will this become? This will become intussusceptum. And if we look at the love and belly image, so the entering one is known as intussusceptum and the outer tube is known as intussuscipiens. And this is what called the apex and this is what called the neck. And this is what intussusception. Now this was also the repeat and this should not be right. Peptic ulcer, I have told you multiple times, it's an important topic. What is the common site of peptic ulcer? It is either the first part of duodenum or the lesser curvature of stomach. Most peptic ulcers are caused by H. pylori or NSAID. And which is more common? Duodenal is more common than gastric. If you have this much knowledge, you would have solved this question. So, which of the following is regarding peptic ulceration not correct? Most peptic ulcers are caused by H. pylori or NSAID. That is true. Gastric ulcer is more common. This is wrong. If you would have know this point that duodenal are more common, your answer would have been straight away. Rest these things are correct and we have discussed this also. You should have made this image correct. What is this image signify, guys? I have told you multiple times about Kellogg's triangle. What was the previous definition and what are the recent boundaries of that? So we have common hepatic duct, interior surface of liver and the cystic duct and the medial border of gallbladder. If you look at the question, this was the liver, this was the gallbladder and this is what they are asking about. So even the options were not confusing. Kellogg's triangle is the only one you would have been knowing. And if you would just quickly revise out the boundaries in your mind, so the answer would have been direct. It is a Kellogg's triangle. Again, this is easy. And now, which maneuver? So this is liver, this is gallbladder. These are all these three, triad of, we have common bile duct, hepatic artery, portal vein. So we know what the Pringle maneuvers does. It's a surgical technique which is used to control the bleeding from the liver by the temporarily clamping this all these three hepatoduodenal ligament which contains common bile duct, hepatic artery, portal vein. This was the portal triad. So we were clamping this, so answer is Pringle. I think this should have been correct. Next, they were talking about the complications of splenectomy. As I said, if we have to rule out one option, so you have to think in the way which can be decreased or increased or so. Pancreatic fistula, opportunistic, you can't change anything. but in the case of thrombocytopenia it can be thrombocytosis. So if you can flip the question in the other way, so that becomes the option in that case. All these you cannot change the wording in that, but here you can change. So if you have to rule out, that means answer was this. But if we talk about, so what are the complications? So if we talk about the complications after splenectomy, first is atelectasis, second is pancreatic fistula, third is post-operative thrombocytosis, and opportunistic post-splenectomy infection. So these can be the complications. So it is not pnea, it is thrombocytosis. So the answer for this question will go 1, 3 and 4. Question number 64. क्या हो गया भाई उसमें? Ma'am, whereas the child is just 6 week, है ना? 6 week is there. Why we are giving ORS now? That's again a tricky one, है ना? अरे यार, this iPad is not in a favor of us today. They don't want us to discuss further. That is the confusing one again here. 6 weeks में why we would go ORS, that should be on the breastfeeding. So yes, there is the chances. The answer can be 1 and 2 here, है ना? But let that answer key come within a week, it will come. Yes, after listening your point, I also feel that answer should go 1 and 2. Let's see. I think answer should be A now. You are correct at your place. I missed out on the age. Okay, the screen again disappeared. Just a sec. Let me correct it. See, why you should listen to this solution, so that you don't repeat the mistake in the NEET PG. What has done has been done. Nobody expected that UPSC will create the question like this. I think everything is fine now. See, UPSC is a game of rule out thing. Next year also you cannot predict the paper. Okay, so we were on 101 question. Now this was important and this was discussed in the update session 2, that they have created a separate designated paragraph for vaccines in pregnancy in the latest Datta edition, and they say in that vaccines contraindicated in pregnancy are measles, mumps, rubella, varicella and yellow fever. If you look at the question, then the answer would have been C in this case. Chorionic villus sampling. Again, it was a predicted topic. It has been important. If you talk about prenatal diagnosis, it always become important. So if you talk about chorionic villus sampling, then it is performed for prenatal diagnosis. When it is done at around 10 and 13 weeks. And what are the complications? If we do limb reduction deformity is low when CVS is performed after 9 completed weeks. So what they were saying in the question, we have to choose the correct statements out of this. It was done between 15 to 20, that is wrong. It is done between 10 to 13 weeks. Next they are saying amniotic fluid is done before that. No, amniotic fluid is done after 15 weeks. So it is later after that. Limb reduction deformity is low when CVS is performed after 9 completed weeks. This is correct. and we give NTD 50 microgram following the procedure in RH negative mother, that is also true. So this case answer would be 3 and 4. Now this I have discussed. I don't know why you made this question wrong about the management of third stage of labor. So what we are giving? We were giving either oxytocin or misoprostol or methargin. We do not give carbiprost. So they were asking which is not given in the third stage of labor. We were giving oxytocin, methargin, misoprostol. We are not giving carboprost. Now onset of labor, we all know how important that topic was. Now they framed out the that statement type of question, which is assertion and reasoning out of that. So if we look at the onset of labor, so if we talk about progesterone, so increased fetal DHEAS and cortisol inhibit the conversion of fetal prognolone to progesterone. That should be increased to inhibit this conversion. So which leads to its fall before labor. And it is the alteration in the estrogen progesterone ratio rather than the fall in the absolute concentration of progesterone, which is linked with the prostaglandin synthesis. So first question is, they are saying alteration in estrogen progesterone results in prostaglandin synthesis. That is true. Decrease DHEAS and cortisol inhibit conversion? No. Instead of decrease, that should be increase. So answer for this is statement 1 is true, but statement 2 is false. Now last year also they have asked the question about WHO labor care guide, and they have now added it in the recent edition. So WHO labor guide means that active phase instead of 4 centimeter, now it is starting from 5 centimeter. That is true. There is fixed rate for dilatation of every hour? No. It was the fixed rate before, but in the WHO labor care guide there is no fixed rate now anymore, and there are no alert or action lines on the partograph, and there is a separate section for the stages of labor in that for the monitoring. So if you go through the datta, there are intrapartum care about the WHO guidelines. So there was first stage of labor in which they have talked about this, and after that they have second stage. So you can go through it deeply after this session. So for this the answer is 1, 3 and 4. Next is, which of the following are positive indicators for breech vaginal delivery? So I have told you for vaginal breech delivery what criteria to be fulfilled, right? So criteria to be fulfilled are, that should be average fetal weight between 1.5 and 3.5, not less, not more. There should be flexed fetal head, there should be adequate pelvis, and there should be frank breech, not other flexed or something. So it was a frank breech, it was fetal weight between 1.5 to 3.5 and gestational age more than 34 weeks. Fetal weight less than wrong, fetal weight more than wrong, and flexed is wrong. So answer for this is C. Which one of the following correctly defines the purpural pyrexia? So we have discussed abnormalities of purpurium, in which I have told you what is purpural pyrexia. If the rise of temperature is reaching 100.4, not 101.4, and on 2 separate occasions at 24 hours apart within first 10 days following deliveries. So it was rise in more than 100.4, 24 hours apart, and within first 10 days, which makes A as the correct answer. Next is, they were giving mother present on day 8 of normal vaginal delivery with painful left breast, with chills on examination, her left breast is tender. See what they are talking about. They are talking about the acute mastitis, and we all know about acute mastitis, how it presents and how we will manage it. We'll continue the breastfeeding with the good attachment, but from the unaffected side, and we will, the infected side, we will empty it manually with each feed, and we will give antibiotics. So they were talking about acute mastitis in this case. So we will give analgesic antibiotics, plenty of fluid, but this was the abscess was present in left breast. So we will breastfeed from the right breast. So answer for this is A. Now they were talking about preeclampsia. Now many of the students made this wrong. See what they were saying. How will you say it severe feature of preeclampsia? So if I talk about severe features of preeclampsia, to classify it severe, so we have either there should be a severe blood pressure elevation. The blood pressure should be more than 160 or the diastolic should be more than 110, at least 4 hours apart. If we talk about CNS dysfunction symptoms, if they are present, again it is severe. If any kind of hepatic abnormality, like we have upper quadrant or epigastric pain which is not responding to medications, or we have thrombocytopenia, platelet count is less than 1 lakh, or there is any kind of renal abnormality where creatinine is more than 1.1, or pulmonary edema. Nowhere they have talked about proteinuria to say that it is a severe feature of preeclampsia. So 1, 2 and 3 is correct. So our answer is 1, 2 and 3 for this case. They were talking about grading of abruptio placentia. Now again many students are confused in this. I have told you the grading of placenta abruptio. If the vaginal bleeding is mild, it is grade 1. If the vaginal bleeding is moderate, it is grade 2. If fibrinogen level is decreasing, it is grade 2. If the maternal pulse is increasing, it is grade 2. But if the fetal death is present, that is the rule to say it is grade 3. I can see the chat section is fill up just how many correct or incorrect or what should be the cutoff. I don't think you are enjoying the session. If this kind of behavior is going to be there, then definitely no paper 1 discussion is going to be from my side. I would just simply say what should be the cutoff, and that is, I think, more than enough for you all. You are not at all interested in listening what should be the correct answer to help you in future, right? So from my side, I'll make sure that no paper 1 discussion will be released. You just have the cutoff videos surrounding and I don't have any cutoff video, so that would not be coming from my side. This is the last session which I have conducted for you all, right? So let's focus on cutoff. I think I should stop at this place only because you all are more interested in cutoff here instead of listening. है ना? You love the PDF sessions where you just message and you get the DM. You are not interested to know what is the correct answer. So let me just finish this, then we'll not having paper 1. Okay. So they were saying fetal death. So fetal death is the rule to say it is grade 3. Now you have to rule out to say it is grade 3, moderate vaginal bleeding that was present in grade 2. Maternal tachycardia that was present in grade 2. Low fibrinogen level that was present in grade 2. But intrauterine fetal death, that was the rule to classify it under grade 3. So the answer would be D in this case. Now this was a direct repeat from last year and my whole year gone in justifying it. Ki please the answer is 3, not 4, not 5. Because this is the exact table from the Love and Belly where they said that lidocaine maximum dose is 3 mg per kg without adrenaline, and if we give adrenaline then it becomes 7. I don't know why you still confuse between this. This answer should not be wrong. It was a direct repeat of 2025. So lidocaine without adrenaline, answer would be 3 mg per kg. Please don't get confused and just learn this table by heart. A young lady is brought to emergency department following stab injury to right chest. She is gasping for breath with tachypnea, distended neck veins and tracheal shift to left on examination. There is hyperresonance and breath sounds are absent. I have told you pneumothorax in detail. We were discussing tension pneumothorax. So what is tension pneumothorax? We will have tachypnea, we will have dyspnea, we will have distended neck veins, tracheal deviation, hyperresonance, and decrease or absent breath sound over the affected hemithorax. So that makes the diagnosis right tension pneumothorax here. Glasgow coma skill, it is predictable, and I think everybody would have done it right. You all know about this table. So E2, V3, M5 if you put out all the values. See, moderate bleeding is a part of type 2. What I am saying is you have to focus what does fetal death is the something which call it is grade 3. So that is the better answer you should go for. Now this I think NEET PG people would have done this question correct. So if we talk about Leaford fracture, so this is Leaford 1, this is Leaford 2, and this is Leaford 3. So we were having fracture here, same like this. So this is Leaford 1 in this case. Which of the following are the important parameters to be maintained in a patient with an head trauma? See, this we have discussed and it has been asked before. They just frame out the different language and you just can't correlate. Okay, this was the thing which was asked. So they were asking, previously they have asked key parameters which you need to maintain in head injured patient in neurointensive care, and now this time they have framed this like which need to be maintained during head trauma. So we have discussed sodium should be more than 140, mean arterial pressure should be 80 to 90, intracranial pressure should be less than 10, and this is what PaCO2. So sodium was more than 140, which is correct. Cerebral perfusion pressure more than 60 is correct. Intracranial pressure less than 20 is correct. Mean arterial pressure should be 80 to 90. It should not be 70 to 80. So the answer for this question is going to be 2, 3 and 4. Now this needs no knowledge. You would have easily done that. They were asking highest dose of ionizing radiation. We all avoid doing CT head and check because it contains the highest radiation compared to the options given. So we'll go for CT head and neck. I think everybody would have done this correct. See, I have summarized the short subjects in a very few pages because those topics are just asked. We don't have to read short subjects in detail. So this time this came. We talked in anesthesia about the airway assessment. I have told you what you need to assess. We have to assess modify Malampatti, mouth opening, thyromental, thyrosternal, ability to protrude the jaw. They have exactly asked the same. And they were saying which of the following we have to do in this. Mouth opening, yes. Ability to protrude the jaw, yes. Thyromental, yes. There were nowhere mentioned cervicomental. So the answer is 1, 2 and 3 in this case. Now again for this question, I can't commit what is the correct answer. है ना? As per what I what I assumed from this diagram is matching with this, है ना? So it can be the matrix suture, and I have talked with 2-3 surgeons. They are saying it is matrix sutures, but somewhere ChatGPT and Gemini are saying it is Donati. See, I have no knowledge in depth regarding this. So it can be matrix, it can be Donati. So once the final answer key is out, we'll go with that answer. But as discussed with few surgeons, currently I would go with matrix. Which of the following gastrointestinal secretion normally do not contain bicarbonate? ठीक है, so they ask do not contain. You need to find out. So again, I don't think you should leave any table from Love in Valley now. They have asked all those tables which have not been asked before. So it's time, whatever the remaining table, they will target that next year, right? So composition of gastrointestinal secretion, only 2 in stomach and duodenum. There was no bicarbonate. So they were asking which of the following gastrointestinal secretion do not contain any bicarbonate. So as we all can see, stomach and duodenum is going to be the answer for this case. So 1 and 3. We will go for 1 and 3 in this case. Now the next question is, again this is very confusing, as I myself has taught about the hemorrhagic shock grading class 1, 2, 3 and 4, and in that I have told you that if it is around 1000 ml it should be class 2, right? But here it is having hypotension, the BP is falling, and the fall in BP is seen in class 3. That's why the answer is class 3 in this case. Okay, so class 3 would be the answer for this case if we talk about the fall in BP. Fall in BP would have not been mentioned, and if we just go by the definition of ml, so Levin Bailey just simply classified on the basis of percentage of blood loss in the terms of percentage. So if we go by that way, it is class 2. But if we go in terms of low BP, so it would be class 3. So we are done with the discussion of paper 2. So I assume at least 70 questions could have been done correct out of 120 in this paper, and you would have left 10-15 questions. So for me, if we talk about cutoff, if you are getting 300 plus after combining the answer key of both the papers, so you would go, see, 90 BP, 90 systolic, it is less than 120, so you can consider as fall in BP. See, again I said we will wait for the final answer key. I have already told I am not the person who has created this paper. I have just shared from my knowledge point of view what should be the correct answer, but I am not 100% sure. You should take plus minus 15 from this lecture. Your score can be plus 15, can be minus 15 once the final answer key is released, because this is, again I said, is confusing. This suture one was confusing, that ejaculation question was confusing. There are 4-5 questions in which answer can change. So once that key is out, I will upload all the changed answers. We will not discuss the paper again, we will only discuss those questions what the UPSC says as the final answer, because if we are appearing for the paper UPSC, then we should know the answer key of UPSC in that case. So yes, the paper was tough. If you are scoring 250 to 300, you can expect to be called up for interview, but it is like not completely you are in the race, not completely out of the race. But if you have scored 300 plus, then definitely you are in the race. You can consider yourself in the safe zone. And 250 to 300 should not demotivate. Yes, they have the chances in their hand. So that's all for this session. Thank you for being with me in this. Okay. See, after seeing the cutoff videos, you have really demotivated me to take the paper 1 session. I know you don't, you have the other mentors as your mentors. You have not conducted this session. I've just taken it as your senior. You all were discussing with the pages answer keys circulating around. So I just displayed you the correct answers from the standard textbook so that confusion get over and you get back to your studies for the NEET PG preparation. That was the whole motto. Okay, and if I could have helped you some way in this, that is more than enough for me. Okay, thank you